Hi guys, my name's Dr Sarah Tonks. I'm a cosmetic physician in London. Welcome back to the channel, welcome home. Today I am going to be doing some more of a video which was very, I guess, well received, and you guys requested that I do some more. By the way, the more astute of you will know that yes, I have dyed my hair and I think it looks rather fetching. I hope that you do too. So a few of you have sent your photos in, so thank you very much for if you were somebody that sent your picture in. It's very much appreciated. I had so many, I'm going to have to split it over two videos, so I'm going to do some of them now, the ones which I've got pictures from the front and from the side, and then next week or the week after I will do the ones which are just from the front. So if you are not in this week, do not worry, you will be next week. So without further ado, let's go over to our first victim, volunteer. Okay, a lovely looking lady here, no complaints myself. If she came into the clinic and gave me carte blanche to do whatever I wanted to do, these would be my suggestions. We do have a little bit of acne going on here, so I'd want to know what skincare she's using right now and try and improve whatever she's using. So, you know, using some acids, adding in some retinol, that kind of thing. Maybe adding in some blue light therapy, or maybe even a bit of laser work as well. Sometimes that can work a treat. But I know what you guys are hungry for, and that's injectables. So let's talk. I think the upper third of the face is generally very good. I don't really feel the need to make any intervention there. I guess we could talk about maybe trying to raise the tail of the brow slightly using some Botox. I don't know if she's already had Botox, but it could be something to think about. You see there's a bit of a discrepancy in the A-frame just here on both sides. We can even that up slightly. I'm really getting a sense of a lot going on around here. It's all in the eyes, isn't it? I need to find a way to make her a little bit less tired looking. One of those ways would be to use some Botox if she hasn't already had it. Another way would be to raise up the outer corner of the eyebrow using a bit of filler right here. I'm not doing it because she's got hollowness in the temple. It's because I'm trying to lift up the eyebrow, trying to expose a bit more of the upper lid. You see here we've got some scleral show. That's the white underneath the coloured bit of your eye, and as you get older you can see more of that. So what that means is that the lower eyelid is just dipping down a bit too much. By the way, I totally have that, and I only just realised that it was a thing for me about 2 months ago. I think it's just because I'm getting older. I was looking in the mirror thinking, oh my Christ, look at that. Not good. How do we get rid of it? Well, you can add some filler on the cheekbone here. That's the first step. So add it here, it will pull back. Then you add some filler right here, and then that has the effect of going a bit like this. And then you can tidy it up by doing some in the tear trough. Why don't you do the tear trough first? Are you mad? You can't do that. You cannot do the tear trough first because it will look like you've got a big sausage underneath your eye. Everything has to happen in a certain order. And if you do it out of order, it's not going to look good. So just don't even bother trying, because honestly, it won't look good. I think even then, she's still going to have some darkness underneath her eye. So we could talk about doing some PRP. And the way that I like to do it, obviously you take the blood, put it in the centrifuge, and then I re-inject shed loads underneath the eye in that area. It has the effect of just tightening up the skin very slightly, increases the blood flow there, generally covers up. No, hang on, that's what I'm doing. Sorry, I just got a bit distracted there with my doodling. Generally makes the under eye area look a little bit brighter. You could also maybe layer in a fine product like TSL Dentistry 1. It's got additional vitamins and minerals in there, which again help to support the skin health. Got some loss of volume here, guys. You see this line coming down like that. So you've got fat pads, big fat pad here, and they're starting to separate, which means that this bit becomes no man's land. Ooh. You get a big old divot there. So what do? Simple, really, because it's all part of the same procedure. So when you've replaced the volume up here and here, then this crease will start to look better anyway. Really like the lips, very nice. I think the lower third of the face, pretty good. All the action's in the mid-face, isn't it? If I was being super picky, and why the hell not, I would try and even up the chin and have the chin point slightly more centered. Let's go and talk about the lips. Looking very nice. I do think, you know, I think you could take a tiny little bit more in the upper lip right here. I think it would be very sexy to do that. I mean, she's got a lovely pair of lips anyway. And let's be honest, she's a gorgeous, gorgeous girl. But we're talking about just making tiny tweaks here. So if I were to do her lip, I would do a little bit of emphasis here, 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 and here. And here as well. Does that kind of look like a weird cat? Or is that just me? Anyway, that's where I would do the injections, and I'd use something quite fine, probably something like Juvederm Volbella. It's quite good in that sort of situation. All right, so I do have a picture from the side, looking pretty good, I think. Very little to say, except I would maybe just emphasize the angle of the jaw very slightly. As you get older, this angle changes from being a nice L shape, like yay, into more of a J shape, like this. Sometimes even an I, which is straight. You can really see the darkness around the eye here, can't you? I'd probably do some laser as well here, just to remove those little thread veins and redness. All in all, though, I would be thrilled actually if she walked in and gave me carte blanche, because it's very easy to make somebody like this person look upgraded, because she's got fantastic bone structure already. She's got really good soft tissue, so there's very little sagging, not really any lines to speak of, good quality skin health. So she's super easy to treat. Please come and see me. And thank you for sending your picture. Next up, we have one brave queen who has decided to send her picture in. Look, obviously, with a case like this, surgery is the gold standard, because there's nothing that I do which will be the same as removing the excess soft tissue here. It just doesn't work like that. I can definitely make an improvement, but this is a eye pencil, not a magic wand. Nevertheless, if she came in and said, do you know what, I've got myself a toy boy, there's my black Amex card, I really don't want to have anything surgical done, do whatever you can for me non-surgically, I would be more than happy to oblige. What would I do? Well, the photo's a little bit angled strangely, so I'm just kind of guessing here, but I suspect we've got some volume loss in the temple, because that's pretty common. We've probably got some volume loss in the middle third of the forehead, so I would fill that. We do have some of these horizontal forehead lines at rest. I would put Botox in, because in everybody it tends to make the eyebrow position a little bit nicer, you look a bit more rested afterwards, so why not just have some Botox. We do have some eyelid hooding here. Again, if I could possibly persuade her to do a blepharoplasty, eyelid surgery, then I would do upper and lower, because that can make a huge difference to the way someone looks. If not, I would try and manage non-surgically. So some people use advice a plasma device, for example, something like Plexer, which makes tiny little, well, they're burns essentially, in the skin, like this, little dots all over, and that has the effect of tightening up the tissue. I personally don't use that device. Why? I think sometimes it can work quite well. However, the downtime that I have seen people need can be a bit too extensive for my taste. So I would really much rather suggest someone have a surgical option, because then they can reposition the fat as well. As long as you're going to a good surgeon and not just somebody who trims off the excess skin there, you want somebody who's actually going to understand the underlying anatomy and will reposition the fat as well. Otherwise, you end up with too much hollowness there and it still looks a state. Fine lines here. Again, you can minimise those using a bit of Botox. I would PRP the whole of the orbital area, because even if she is going to have surgery, PRP will help to improve the skin health and healing will be much faster. She'll also have fewer fine lines and wrinkles post-surgery. There is some asymmetry, so you can see this side of the cheek is wider than this side of the cheek is. That's something that we can look to correct using fillers. We've also got more fullness in this area here than we do over on this side. Realistically, how much can you do? Well, I mean, you could do an amount. You could do an amount. Obviously, it's not going to be the same as a surgical result, but if you put a bunch of filler in the temple, a bunch of filler on top of the cheekbone, and a bunch of filler in front of the ear, we do have a side view, so I will show you that in a minute. It will give her some tissue repositioning. You can also then go and fill the nasolabial line. You guys have probably noticed that I don't fill that very often in the patients that I treat on my YouTube videos, and that's just because I actually don't treat it that often myself. Like in a given day, the chances are I probably won't do an injection into that area. Because there are other things that I prefer to do. Moving on. Do you know what? If I had £1 for every time somebody came in about these bloody lipstick bleed lines, well, I'd have some money, put it that way. Everybody asks me about them. It's really interesting, actually, isn't it? Like, there's a rule amongst us aesthetic doctor people. If you can't see it when you're sat opposite somebody at a dinner table, at a dinner party, then don't worry about it. I think the dinner party bit is because it's low level lighting, but anyway, then don't worry about it. And sometimes these little lines that you get here, you can't see them from that distance, so don't worry. I suspect actually on her you might be able to, so okay, let's worry. It's a valid concern. Nevertheless, I wouldn't treat them until I'd treated the rest of the lower face. So what I mean by that is filling the chin crease, filling the angle of the jaw, which I will show you in a minute, filling this little dimple right here, marionette lines, and then working on the lips. So you see the ratio is just a bit off. It probably was the same throughout her life. I would add in the central portion of the lower lip, remember guys, the fullest part wants to be in line with the eyes, yeah? And then to do these little lines, I would take a cannula, go in right here and sweep it across like so, giving support from underneath. Of course, while you are doing that and treating it from underneath, you can use an energy-based device, laser, radiofrequency, needling, what have you, from the exterior to really get a very good improvement, and I would definitely encourage her to do that. If you're having skin improvement laser, it really can't hurt, you know, it's a good thing to do. The neck, well, you know, very limited, because all this excess tissue I can't really do anything with non-surgically. Yes, people talk about putting threads in the neck. I don't really like doing it. I find the downtime is a bit too much, and People don't tolerate it well. Okay, let's check from the side. There's not much that I can do non-surgically about this. It would be much easier just to have a neck lift done. And it would make a huge difference. So I know a lot of people are frightened about having surgery. They don't want the downtime. There are things you can do to try and minimize that downtime. I mean, first of all, obviously pick a very good surgeon. Don't just go for some random. By the way, you guys would not believe the number of times that I've seen somebody having their eyelids done and it looks a state afterwards because they've taken away too much fat. Don't have your surgeon do that. It looks worse afterwards. So minimizing downtime after surgery, make sure your body and you are in good condition before you go ahead and have surgery. There was something in the news recently about how not exercising is worse for your health than smoking. Like, can you actually believe that? So, you know, make sure you're in good condition before you go in for something surgical. Make sure you are nutritionally sound before you go in to theatre also. And yeah, taking stuff like bromelain obviously will help, but it's all about the stuff leading up to that, isn't it? This is something that we see quite often as well, and it's descent of the fat pads to this point here. I have it as well, I'm sad to say. What do we do in a case where it's not too bad? Well, you can put some threads in, you can use some ultrasound and radio frequency to help to contract the tissue and lift it. Both options. If she came in and was interested in such a procedure, I certainly would offer radio frequency and ultrasound because there isn't really anything that can significantly go wrong there. Well, I mean, there is, but it's very unusual for that to happen. And often people can be very satisfied after having that treatment done because there's no downtime. They get to go on with their day afterwards. It's not particularly painful to have done. So it's got a pretty high satisfaction rate. Threads you could do. Again, it's not going to be the same as doing something surgical. You'd have to put quite a few in, and I don't like adding that many in one go just because of the downtime that the person gets. I know it doesn't look like it from my videos, but I'm actually kind of conservative with the treatments that I like to do because I like to be safe than sorry, put it that way. And last but not least for today, ta-da! Last patient, kind of similar, but obviously she's a bit younger. I think I could get a good result with her non-surgically because although she has a very full face, the tissue quality looks quite good. So this is how I would do it. Most of the action is here, but let's just go from the top. Obviously we're going to do some Botox because we want to raise that eyebrow up slightly. And I would fill the temple as well because she's lost some volume here. She's also lost some volume in the forehead right there too. Got some fine glabella lines at rest as well. Another reason to do that is because we can't really see much of the upper lid. Again, I would say, lady, it would be good if you would have some eye surgery, but you know, if you don't want to, that's cool. Looking at the symmetry, we're more full here than on the other side. I wouldn't worry about that initially. What I would do would be add some filler along here, and then you see where she's got this trough just coming like that, where the fat pads are starting to separate. I'd fill that too. You'd have to use quite a lot to get a good result on her, but it would definitely be possible. And then I would put some filler in front of her ear as well to lift that. Sure, I think she could do with a bit right there too, because when you fill underneath the nose, it helps to smooth the nasolabial line out a little bit. I feel like, well, I haven't seen the side view yet, but I feel like she could use a bit of something on the nose too, just to give her a bit more of a slimline look. I'd want to know, is this bulk? Is that muscle? Is that parotid gland? Is that fat? What is it? If it's muscle or it's parotid, I would put some Botox in here to try and slim that down. If it's fat, fine, I would put something in Aqualix, you know, fat dissolving injections. Kai Bella to all of you in the States. I'd also do the same thing underneath the chin. See, she's actually lost some volume here across the chin crease and also here as well. So I'd fill both those two areas, and I'm going to leave the chin until we look at her from the side. You see, there's a bit of a discrepancy in the lip. By the time that you fill the rest of the face, the lip will probably look quite small. So you're going to have to fill that too. Her ratio is a bit more 50-50, so we want to keep that. We are literally just replacing any volume that she has lost. So I would Aqualix all this around here, tighten it right up. I do feel like we could just add a smidgen of filler here, just to make the nose look a little bit more aquiline. Chin looks good from the side, don't you think? We do have some texture irregularities that are more easily identifiable from the lateral view. So you can use hyaluronic acid underneath those. I like using either Juvederm Volite to pick them off, or maybe sometimes some Profilo, which gives more of a field effect. I also like using Regenial Bioexpander in an area like that too. That's a new one to me. I took it on quite recently. And then looking at devices to stimulate collagen from the outside. So needling, intracell, anything like that, E-matrix, that would all be good. So some fractionated laser would be good as well. Don't be scared if you've got darker skin type. You can always have laser. You just have to be careful about who you go to. Make sure they've got the right laser for you. Yeah, and that is it. Okay guys, so that's it. I hope you enjoyed the video. If you weren't in today's video, don't worry, like I said, you will be in next week. So I'm gonna probably just film the next one now, but I'm sorry, you're gonna wait till next week. I can't release everything in one go, it's impossible. So I will see you then. Bye.